Hi, I'm Kusum, your maternal child clinical instructor, and I'm going to record this for you guys so you have it in Blackboard. You can watch it as you try to learn this thing. I'm going to show you postpartum assessment about the mother after she has delivered. So please understand, all I'm going to say is very important for you to know, because there will be case scenarios here that I will allude to as I go through it, but I will not tell you exactly what the case scenarios will be. And you're going to be dealing with it and be answering, and you'll be doing SPAs, and you'll be talking to the doctor as well on the phone and stuff like that. Right now, what I would like you to do is I'll show you how to do an assessment on a mother who has just delivered and postpartum delivery. After postpartum, what do you do? The first thing you do is when you come into the room, you need to wash your hands and introduce yourselves. After introducing, you need to watch the family dynamics. Where is the baby? Is the mother holding the baby? Is the mother concerned about where the baby is? Watch who is in the room, because you will be documenting who was in the room that was present when you entered the room. So please make sure you know the family dynamics. That's the time you'll understand and know right away as you watch the family dynamics whether your patient is going to go into postpartum depression or not. Postpartum blues is normal, but postpartum depression, and especially there are three types of postpartum depression: minor, major, and then psychosis. Postpartum psychosis means that she'll go and kill all her babies. So it's best for her not to go to that level, so you need to watch the family dynamics. As soon as you enter and introduce yourself, you say very quietly to her, who do you want in the room? Because remember, you're going to expose her to see what's going on. In order for you to know and expose her, please give her that privacy and ask her who she wants in the room. Please understand that you need to ask her quietly and not loud, so she can answer to you quietly. Not everybody needs to hear, just in case she doesn't want people in the room. So after you've asked her and you've told the people to come out, you do your assessment. Now, the first assessment you do is a 30-second rule. Because the most important thing is she bleeding? Is she hemorrhaging? If she is hemorrhaging, she can die from that bleeding. So that is far more important than anything else that you do. So in order to get there, you need to do first 30-second rule. In the 30-second rule, you'll have a machine. You go ahead and put the blood pressure on. As soon as you put the blood pressure, and in this case, it's in this arm, on the left arm of my patient. So you put the blood pressure on right away. Let the switch on the machine. The machine will do the blood pressure as well as pulse. Once that is done, you need to do this. This is where you keep your stethoscopes. You need to listen to her lung sounds quickly, and you just put the stethoscopes here, right here, and you put a stethoscope right here. As soon as you've done it, remember 30 seconds rule. So you are not going to do minute. All this has to be done within 30 seconds. So you put here and put. Then you need to look for apical pulse. Apical pulse is on the 5th intercostal space. So with a woman, it's right underneath her breast tissue, and you may have to sometimes lift, it's big, and put it right by the nipple mid-clavicular line. That means right underneath the nipple is where your apical pulse is. So this is where you put your stethoscopes. So you listen for the lungs quickly, put your thing. She's nice and strong pulse. Don't worry about it. Then as soon as you've done it, many of these things you have to do bilaterally, not unilateral. Bilateral means you have to do it on two places at the same time. The next thing you do bilaterally is go ahead and do a radial pulse. Now, radial pulse is where your thumb is. This is your thumb, and this is where you go. And this is how you put your part. Do not put your hand like this. If you do, then what will happen is that you're feeling your own pulse. So your fingers should be like this. And you put two fingers here like this and two bilaterally. Just tell her, I'm going to do pulse, so I'm going to go over you. So you go and do her pulse bilaterally in just few seconds, because this is all a 30-second rule. So before you look at her fundus is where the top part of the uterus, which you need to have it firm. You need to make sure that it's firm. If it isn't firm, if it's boggy, she will bleed. So understand that that is what you need to check, is the fundus. The fundus, again, is the top part of the uterus. Before you even check, you need to make sure, because you're going to manipulate here, it's best to listen to the bowel sounds before you even manipulate her fundus or check it. Because if you do manipulate here and do other things, you will, when you auscultate, you think you're hearing a bowel sounds and you don't. all this time while you're doing it, so here's how you do the vowel sounds. Above the umbilical, here's the umbilicus, and here's one side here and one side here, one side here and one side here. In the meantime, as you're doing all this, you need to continue to talk to your patient. How are you doing? How are you doing? Are you breastfeeding your patient, or are you going to bottle feed your patient? Have you had a bowel sounds? Have you had a bowel movement? Have you passed gas? All that is very important for us to know where she is, because you should not be giving her solid food if she has not passed any gas. Otherwise, she'll be very uncomfortable, especially if she has had a C-section. So by talking to her, you're also looking for level of consciousness, how she is, if she's oriented to time, place, and person. So by just talking to her, you'll know that she's okay. Once you've done that, again, a 30-second rule. Remember, lungs, apical pulse, radial pulse, and vowel sounds, and talking to her while doing this. Please don't be focused on your task, that you're not forgetting that there's a real person there. So you need to continuously communicate with her.